Well, good afternoon, everyone. When the Senate last acted with regard to COVID-19 back in March and April, we had at that point added about $3 trillion to the national debt. We then, of course, ended up with a debt the size of our economy for the first time since World War II, which is in and of itself concerning. So I said I thought we needed to push the pause button, begin to see the impact of the CARES Act and related acts that passed during that period, see how we did when the economy began to reopen, and take another look at what the country needed in July. We, meaning Senate Republicans and the administration, have been consulting over the last few weeks to come up with a realistic proposal with what we think is an appropriate amount of additional debt to be added to the economy at this time. We think it is about $1 trillion, and we've allocated that in a way that we think makes the most sense for the country at this particular time. It will include liability insurance, which liability protections, which Senator Cornyn is going to describe here shortly. But let me just make it clear, there won't be a bill that passes the Senate that doesn't have this in it. There have already been 3,500 lawsuits filed. The country cannot stand an epidemic of lawsuits on the heels of the pandemic. We're already working our way through. So with that, I'm going to call on my colleagues who have developed the various component parts of our proposal, and I'm not certain who comes second. Do we know who's next?
Richard Kelly. Richard Roy. Richard Goldman.
Pop, who's second?
Chairman Grassley.
Senator Grassley.
Here's the list.
Okay. Number one, we're going to continue the economic impact payments that were made in April and May. That means that the average family of four will get another payment of $3,400. It includes just a few people that were unintentionally left out of the last one, mostly dependents, college, and adults that are somebody else's dependent. We extend additional unemployment insurance, and remember that's on top of whatever the different 50 states give, and on top of the economic impact statement I just gave. So we want to continue to help the unemployed, but we want to encourage work. And we've learned a very tough lesson that when you pay people not to work, what do you expect? And so this payment will be adjusted so that we have additional payments to help people for approximately 70 to 75% of their income. That's not me. I don't think so. Well, it sounds just like mine.
It sounds like my wife. A bad answer too.
We're going to have further tax relief for businesses to encourage hiring and rehiring, and we want to do that to encourage people to get back to work and help the employer in the process support people in the meantime. Support patients in nursing homes and also foster youth, flexibility on how state and local governments can use federal relief funds, including an ability to use funds to cover revenue shortfall. And if somebody doesn't want me to get on television tonight, I know that. You gotta be kidding. Well, why didn't you tell me that? I'm embarrassed, I'm sorry. Lastly, I hope that Democrats will come to the table and we work out a bipartisan agreement. Thank you very much.
Chairman Shelby.
Well, we all know this is round one. We believe that, as the leader said, as Senator Grassley and others will say, this is for the American people to help get them back to work, keep them at work, get them back to school, keep them in school as safely as we can. We've already put out a lot of money. These are extraordinary times. I know the House has a bigger figure than this, and this is something we're going to have to work through. Overall, we think this is a pretty good package, and I hope that the Senate, in a bipartisan way, will move forward with it.
Chairman Alexander.
Thank you. Most of the things in our bill have meaning when added to Senator Blunt's appropriations bill, so I'll just speak about three: student loans, school choice, and child care. In March, Congress agreed that the 43 million Americans who have a student loan would not have to pay a monthly payment until October the 1st. The payment would be deferred. You'd still owe it, but it'd be deferred. October 1 is just around the corner, so what we propose is, if you have no income, you have no monthly payment. If you do have income, then we'll change the student loan payment system so that you never have to pay more than 10% of your income after you've deducted necessities of life like mortgage and food. Second, on school choice, there are about 135,000 public and private schools in the country, 35,000 private schools, 100,000 public, about 50 million children in the public schools, 5.7 in the private schools. Generally speaking, we think every child is equally important, and so what we propose is about $70 billion for kindergarten through the 12th grade and $30 more billion for colleges. That amount of money for education is about the same as the House passed bill, so there could be an area of agreement. As Senator Blunt will say, we believe that every school should get some money. It would be about $1,200 per person on K through 12. Every school should get a third of that, even if they're opening virtually. And the rest of that money should go to schools that are making an effort to open as much as possible with students physically present. There are many more expenses when you're physically present: buses, more teachers, more space, more protective equipment. We believe we ought to pay for that. On school choice, Senator Scott has a bill which he will discuss, and I'm a co-sponsor of that, which would give parents more choices of all schools. And child care centers are having a hard time staying open because they have less revenue, fewer students, and there need to be more safe environments for child care. And finally, we're spending a lot of money to build up manufacturing plants. We want to make sure that in the future they're not in China when we need to create vaccines. And in the future, we want to make sure we have plenty of masks and other equipment in our stockpiles, so we authorize that as well. This is a bill about back to school, back to child care, and back to work.
Chairman Collins.
The Paycheck Protection Program has been a lifeline to more than 5 million small businesses and their employees nationwide. In the state of Maine, nearly 3/4 of all small businesses have received these forgivable loans that have sustained the jobs of 240,000 Mainers and brought more than $2.2 billion to the state of Maine. We are today proposing a second round of PPP loans for the hardest hit small businesses. Just this morning, I was talking to an innkeeper in Maine who told me that at this time of year, usually his inn would be booked solid every single night. Instead, business is down by 93%. So what we are proposing is that hard-hit small businesses, those with revenue losses of 50% or more compared to last year, would be able to receive a second PPP loan to sustain their employees and to help cover certain overhead expenses. Another important provision allows PPP overhead expenses to be used for renovations that are necessary to comply with CDC guidelines, personal protective equipment such as masks or gloves, and other renovations that may be needed to ensure the safety of both the employer's employees and customers. That will be particularly helpful to restaurants, for example, that are still under strict restrictions. There is also a long-term loan component of the bill that we've introduced, and Senator Rubio is going to explain that when he gets here. I don't think he's here yet. But arguably, this program has been one of the most successful provisions of the CARES Act, and I'm delighted that we are introducing an extension of it today. Thank you.
Chairman Graham.
Well, one, thanks, Mitch, for putting this together. Last time we didn't do much about China. This time we are. So what have we learned? 90% of the protective equipment that our doctors and nurses and healthcare professionals need to keep us safe and keep their families safe is made in China. So President Trump is hell-bent on trying to bring the medical supply chain back. There's a big step forward in this bill. We have a $7.5 billion tax credit to incentivize PPE material to be made in the United States. Gloves, masks, gowns, sanitizers, bedding, $7.5 billion tax credit modeled off the energy tax credit. We think that'll have a big effect on bringing the supply chain back. Under the Berry Amendment, there's a requirement that American military uniforms be made in America. We're going to put PPE under that, so the national stockpile will have protective equipment made in America and we don't have to depend on China. Senator Cornyn has a Chips for America Act. We lost the semiconductor industry, all left. Now we're trying to bring it back. Taiwan made a big investment in Texas. We're going to give tax credits to make semiconductors here, which helps you in another way. Senator Portman's got a bill that I think is much needed to punish people who steal intellectual property in America, to create a security council around research and development and penalties for those bad actors who try to steal their way to success. And finally, Senator Murkowski lives in Alaska. There are a lot of precious, critical metals and materials that America has, but we do a very poor job of getting it out of the ground in an environmentally sound way, and we're becoming more and more dependent on China and other places in the world for critical minerals, and we got a plan to become more American-made and owned there.
Chairman Blunt.
I think about 25% of the bills in the Labor Education Subcommittee, about $250 billion. None of that money that's there was there without the input from Chairman Shelby and Chairman Alexander, who chairs the authorizing committee. Obviously, Chairman Shelby chairs the full committee. On the education front, I think that's probably been talked about enough. You'll have some questions on that later. On the higher education part, the $30 billion or so that goes to higher education, that money will go out on an FTE basis to colleges and universities, and will go out quickly, we hope, and many of them are going to reopen as early as the 10th of August or so. So we need to get that money out. The elementary and secondary money, the 2/3 being held back for people who are trying to get in-person education reinstated again. A lot of that money also can go out quickly. Under our bill, if at least 50% of your students are in person 50% of the time, you qualify immediately for the second 2/3 of the money that would come to your school. If it's less than that, it has to be explained in a different way, left up to governors and the education department and the state to work on that. On the health front, we have 16 billion new dollars, which is a total of $25 billion for testing. Our priority to help with testing through the states is to put a priority on elementary and secondary education, on higher education, on nursing homes and child care facilities. Child care facilities also get a lot of attention in this bill, $15 billion in child care facilities that frankly have a work model that doesn't work at 45 and 50%, which is the likely child care enrollment as people get back to work. Some people don't want to send their kids. Other people will still be looking for work themselves. And so trying to help get the numbers and the space to match. There'll be some child care expenses of distancing and other things that have to be done, but you can't get back to work if you can't get back to child care for most families. And if you're a working parent, particularly if you're a working single parent, your biggest single problem is being sure that that child care situation works. We put twice as much money in our bill as the House did in the HEROES Act. And we'll be talking from moving forward from that point. Another $26 billion in our bill goes to further advance vaccines, therapeutics, particularly vaccines. Our hope, as you know, is to have vaccines out there that are out there by around the first of next year. And in doing that, we're going to lose some money because we're going to move forward with producing some vaccines we think will get full FDA approval that just won't work out. Moving forward with the things we think are likely to work, knowing they won't all work, but also knowing the ones that do work will be available maybe January the 15th instead of May the 15th. And in this environment, having a vaccine in January the 15th as opposed to May the 15th is worth billions of dollars, and we're willing to take a chance of losing some money to be sure that those vaccines that do work are out there earlier. We've got Senator Collins, a big leader in being sure we had money for the opioid abuse that has occurred as people found themselves isolated at home and maybe out of work with another problem there, and the mental health issues. So we've got about $5 billion on that side of the ledger that would not be there in a normal spending year. And there's some hospitals and providers, another $25 billion for them, with a real vigorous discussion with the administration that they need to spend all the hospital provider money they currently have not spent, which is about $65 billion, add that $25 billion to it, and then see how close the providers are to where they would be in a normal year. You know, we ask hospitals and doctors generally, providers generally, to do the two hardest things you could do: stop your income and stand ready for the biggest health emergency that you can imagine that your hospital or your practice would ever have to deal with. And that just doesn't work out very well. So another $25 billion there.
Chairman Rubio.
What's this about? I'm kidding. I think Senator Collins has already outlined the new PPP proposal. And let me just say that what you're hearing a lot now in the small businesses as the PPP money runs out is they're beginning to look at new layoffs, which I think is evidence of the fact that PPP was helpful. The fact that but at the same time is also evidence that we are seeing resurgences in different parts of the country that are placing new restrictions, plus the existing restrictions for many of these businesses is hard to survive under. And then, of course, the consumer behavior is affected by the news of the pandemic. So it's very timely. And in addition to PPP, which is now more targeted at businesses under 300, with some of the same parameters, but with business under 300 and the revenue demonstration, is something what we've seen play out over the last few weeks, and that is that businesses, particularly in underserved and minority neighborhoods, on average, there was a recent study that said 95% of them had less than 2 weeks of cash on hand. So you can, from that, deduce how difficult it's going to be for many of them to survive, not to mention have access to regular capital markets in the future. So as part of this plan, in addition to PPP, there is a loan targeted at low-income neighborhoods, census tracts that are either in an opportunity zone or in a new markets tax credit area, where these businesses could get 2 times a loan for 20 years at 1%, at 2 times of their annual revenue. And these are small companies that would not be able to otherwise gain access to that sort of capital that allows them to survive and grow and reinvent themselves in the aftermath of this pandemic. And what we don't want to see is an unequal recovery. And so for us, it was important to target that. But I think this assistance will be timely for small businesses across this country who are continuing to struggle, many of whom benefited from PPP, and now months into it are kind of staring over the cliff again and worried about what the future would hold. And I remind everybody, once again, this is not a bailout. This is about keeping people attached to their employment. And these are about viable companies who are struggling because of government regulations, necessary government regulations, that are impacting their ability not just to do business, but to stay in business. Thanks.
Senator Scott.
In the month of April, about 1 out of every 4 Americans who lost their jobs worked in the restaurant business. One of the provisions in the Finance Committee on the tax side of this is to increase the deduction for meals, business meals, from 50% to 100%. That will encourage more folks to spend more money in restaurants, whether that's takeout, eat in the limited space in some states. This will provide millions of dollars that will increase the number of hours worked by the wait staff and the number of hours worked by those folks working in the kitchen. If we're looking for a way to help the hardest hit individuals in this nation, one of the best sectors to focus on is the restaurant sector. And this is what the provisions that I'm talking about will assist.
We'd like to draw attention to actually two of the consequences of the COVID crisis that deserve that attention and perhaps don't have as much public awareness as I think they ought to. One is, as a result of the COVID crisis, we're seeing the trust funds for Medicare and Social Security approach insolvency on a much more rapid timetable than we'd anticipated. And secondly, we're adding up a lot of debt. We're going to have over $27 trillion of debt. And that debt requires interest to be paid every year. That debt has the potential of creating more inflation down the road. And of course, it could lead potentially to an economic calamity way down the road for people who come behind us. And as a result, Republicans and Democrats on a bipartisan basis have been working together. And that includes Senator Joe Manchin, Kyrsten Sinema, Angus King, Doug Jones. This is a group of people who have come together, and Mark Warner, along with about a dozen Republican senators. We've all been working together to see if we can't address this. And in the House, there are some 30 Democrats and 30 Republicans that have all written House leadership and said this approach of the Trust Act needs to be included in the next COVID relief package, in the HEALS Act, if you will. And the approach is quite simple, which is we create a process, a bipartisan, bicameral process to address each one of these trust funds individually. So a committee for each one of them to look at how to make them solvent on a long-term basis. And if we reach a bipartisan conclusion and bicameral conclusion, then that can come to the floor on an expedited basis. We have to address the solvency of our trust funds. They're vital to our seniors and to our entire nation. We also have to finally deal with the amount of debt that we're adding up as we rescue appropriately the American people from this terrible COVID crisis.
Say I'm the last one standing here.
Two questions. The first is, it was very difficult for you to get Republicans to negotiate with the administration on this legislation. Yeah? Okay. So it was very difficult to negotiate with the administration to come up with an agreement to begin negotiations with the Democrats. you were talking about $40,000 as an income cap in the direct payments. That is not in the legislation. So what else are you going to have to give to come to an agreement with Democrats and not lose too many Republicans? And also, why is funding for the FBI building in this bill?
I'm not sure that it is it?
There's a limitation to hone in specifically to COVID-related matters, so we'll get more information for you.
Look, I think this is a starting place. You can see that we've had a lot of our members involved in the start, and we can't pass a bill in the Senate without Democrats, nor obviously can it pass the House. So every bill has to start somewhere. The Republicans are in the majority in the Senate. This is the starting place, and you all will have plenty of stories to cover along the way as we have these discussions back and forth across party lines and with the administration. Yeah.
Two quick questions. One, I didn't see any election assistance in this bill. Oh, sorry. I didn't see any election assistance in this bill. Is there in fact, if not, why was there not? And also, you talk about the PPP in this bill, but it did not discuss the airline, the cash to keep airline and air employees still employed. Is there any?
I don't have an answer to the second one. The first one is that we've already appropriated an awful lot of money for election assistance. What we're not going to do is federalize the American election system, which is basically conducted in every single state in very different ways. We've provided plenty of financial assistance, but we're not going to tell them how to conduct their elections during the pandemic, or in my view, in the future either. So that's why there's not additional money in there for election assistance. I don't have the answer to your second question. I'm going to take one more if there is one.
Senator, our reporting is that there is $1.75 billion. There's $1.75 billion for the, quote, design and construction of the Washington, D.C. headquarters facility for the FBI, according to the bill text. Is it possible there could be a $2 billion provision in there that you know about?
Well, with regard to that proposal, obviously we had to have an agreement with the administration in order to get started. And they'll have to answer the question of why they insisted on that provision.
Support that being in there?
You'll have to ask them why they insisted that be included. Okay, thank you.